If you go to our website, www.mentalhealthday.org, you'll discover that today's date is National Take a Mental Health Day. If you go there tomorrow, you'll discover that tomorrow's date is National Take a Mental Health Day, and the day after that, too. So that proves that today is National Take a Mental Health Day, and so is tomorrow.
Your podcast starts in 3, 2, 1.
Oh.
Good morning, Doctor. Time to wake up.
Well, thank you, Ivan. It's going to be a great day at the Mental Health Day podcast. I'm Todd Finnerty. I'm a clinical psychologist, and welcome to the Mental Health Day podcast number 12. Today, Irvin Yalom, one of the most influential psychotherapists ever. Here goes.
Dr. Yalom.
Hi, this is Todd Finnerty. Is now a good
Todd.
time? How are you?
Okay.
Good. Well, I just started recording, but if you have any questions or anything before we get into it, that'd be fine. I can always trim it out since we're not live or anything.
Let's just go ahead.
Okay, thank you. Well, thank you for doing the podcast. And
Sure.
yeah, you have a new book out that's just in paperback now, right? The Spinoza Problem.
Right.
I was wondering maybe if you could maybe tell us some of the background about the book. It follows two historical figures, and maybe you could tell us a little bit about them and about the story.
Sure. Well, it's a novel basically about Spinoza. I've been a long admirer of Spinoza, and I feel that in this book, as in all my books, I'm still writing with my secret audience being the young psychotherapist. So I think of this as a teaching novel, and I'm trying to do some teaching for psychotherapists through this novel. I think Spinoza had a good deal to offer the field. He certainly was someone who Freud acknowledged. He believed that everything's related to other things. Everything has a cause. Everything fits together in a great causative network. That rationality was the way that we had to learn about ourselves. That if we understood things, it led to a certain kind of transcendence. And so I wanted to try to write about the very interesting life of this man, about whom we know relatively little. And the way that I tried to do that was to introduce a therapist, a friend who acted as a therapist. Of course, in the 17th century, they weren't therapists. This was a man who had great powers of reason. And so it was a way of trying to lay bare what Spinoza's inner life might have looked like. As it turned out, it's very hard to write a novel about a philosopher who lives only in his head, who really had no external kind of life since he was excommunicated by the Jews when he was 22 and really had to live a very solitary life the rest of his existence. But his inner life was quite fascinating, and he was probably one of the great rebels of history in that he wrote books that would really try to question our whole belief in supernatural forces and religious forces, and try to argue for freedom, not only religious freedom, but for democratic freedom too. So that's where I started, and then I by chance visited the Spinoza Museum in Germany and found out that the Nazis were there and they had confiscated his books, but somehow they hadn't destroyed them. They'd kept his library, and the person who collected the books said in his report, you can find this on the web, that they think that the Nazis, this will help the Nazis a great deal with their Spinoza problem. So for some strange reason that I had no idea about, the Nazis consider themselves having a Spinoza problem. So that's, in a sense, was the genesis of the book. And I decided then to take the Nazis, and especially the man who ordered the confiscation of the book, a man named Alfred Rosenberg. It's a German name, also a Jewish name, but he was a Nazi and one of the leading anti-Semites, ideologists, and tried to follow his life and his connection with Spinoza. And I did that in alternating chapters with him and with Spinoza. And to understand Rosenberg, I also had to introduce a psychiatrist, which wasn't too hard because Rosenberg did have psychiatric problems and had visited psychiatrists. So I had him seeing a psychiatrist also to try to, psychiatrists acted as a lens to understanding his inner life. So in a nutshell, that's what the book is about.
And the Spinoza problem, maybe just to put it blankly, was for the Nazis, I guess, was that Spinoza came from a Jewish background, right?
Spinoza was Jewish, and yet he was absolutely worshipped by the great German thinkers, by Goethe, and by Schiller, and by Schelling. All the great German, Hegel, all the great German writers really revered Spinoza. But how was that possible? How could a Jew really be worthy of that much attention? So that was in a sense a major aspect of the Spinoza problem for the Nazis.
And you call this and some of your other novels, you call them teaching novels, and you say kind of secretly for the young psychotherapist.
That's my target audience. My target audience is the young therapist. I want them to learn something about these philosophers that I've written about and how they relate to therapy.
Are there any particular lessons that maybe you would like them to see in this book?
Well, one of the things I was interested in is a third of this book, a third of Nietzsche, of his Spinoza's major work is called overcoming the bonds of passion. So I can only postulate that he must have had a lot of problems with his own passions and how you overcome them. And one of his statements has to do there is that one of the ways that we have to overcome the passions, that we have to understand that reason itself is no match for passion, and we all know this in life and in therapy, that you can't reason a person out of the passion. But he's suggesting a very strange thing. He's suggesting we have to change passion. We have to change reason into a passion. To change reason into a passion. What's that mean? That means that we have to try to inflame, I think, the person's curiosity about himself. Find some ways to have him step back and take a look at himself and develop some curiosity. Sometimes when I work with patients, I'm often saying to them, sometimes I think I have more curiosity about you than you do yourself. Make the patient begin to wonder about himself and how he got to be the way he was and how he tends to be so ruled by passions. And then the other half of the book, you're dealing with another question. You're dealing with a question of how do you treat someone that's truly evil, like Rosenberg, like most of the Nazis at that point? Is there some way of reaching them? And I considered myself being the therapist trying to work with Rosenberg, and I used every single trick in the book to try to overcome some of their resistance to looking at themselves. Some of it without much success. However, there is a series of attempts there that I think will be interesting to therapists.
That's really interesting. Before maybe we move away from the Spinoza problem and I start asking other questions,
Yeah.
which I can think of a lot of them. But is there anything else you want to talk about the Spinoza problem, or anything else you want to add?
Well, it's the last novel that I've written. I've written earlier novels about philosophers who also had a great deal of influence in our field, both on Schopenhauer and on Nietzsche. And sometimes when you give a history of psychotherapy course, people tend to start with the 19th century, and you start with Freud and Jung, who of course made their contributions. But it's clear to me really that the the kinds of problems we deal with in psychiatry, people have been dealing with these problems ever since the beginning of written thought, especially going back to the Greeks who thought about everything. So in many of these works, I go back to the Greeks and to some of their ideas, and both Nietzsche and Schopenhauer were very familiar, and Spinoza too, are very familiar with the Greeks. So we're just standing on their shoulders in a sense. I've often written about Epicurus, and in a book that I wrote on overcoming the fear of death, I mention Epicurus quite a bit because he developed a series of arguments for his students to memorize to try to decrease the fear of death.
So you brought up death.
Yeah.
You are, we all stand on the shoulders of giants, of course, but you are one of the probably most influential psychotherapists of our time for sure, and possibly of any time, even if you do include some of the philosophers, at least influential on what we do today. But you're going to die. We're all going to die. You have
Right.
a legacy. What do you think? What do you think that legacy should be? If young psychotherapists are going to remember anything about you and your ideas, what do you think? What do you wish would be the stuff that they remember, the stuff that lasts?
Well, I don't think anything I've really said is terribly new under the sun, but I've tried to emphasize some of the existential dimensions of living and in therapy. And by that I mean, when I started in the field, there was so much attention to the first couple of years of life, and everything was laid down at that point. And really, I felt that was a mistake, and there was so little attention that was paid to other things in life, especially the future rather than the past. What do we think about the future? And what about this vision of our coming to an end? And what about that fear of death? And how much does that frighten us? And how much does that drive us to conduct ourselves as we are? So certainly emphasizing the existential dimensions were important to me, as well as trying to put some meat on the idea of relationship. And I feel it's so important that the patient and the therapist have a real relationship, that they're not working mechanistically, giving the patient a few techniques that he can try out in his spare time, but rather helping him understand what it is to form a relationship with some person like the therapist, and having that be a program, in a sense, in his own mind, a blueprint for how he might be able to form relationships with other people in his life. So I think that therapy is a moment when there can be great authenticity going on between two people, and that can be very exhilarating for people to finally really be honest with someone.
And I think people listening, maybe when they may some may be therapists and some may be people from the general public who might go into therapy. Mm-hmm. If they don't kind of feel that authenticity or kind of those important relationship qualities, they may not stick around for the techniques anyway, right? So it's
that may be, and in a sense that's come and gone with our field. If you took a very strict Freudian approach, which Freud himself didn't do, but you wanted the patient to free associate and you were kind of an observer making only interpretations. And I think I understand what Freud was doing there, and it's an interesting approach, but I think he sacrificed the power of the relationship. So I don't think that's a good model for therapy.
Well, I appreciate that. I hate to, to bring up thoughts of your death, but what's on tap for you next then? I mean, to kind of think about the future. I mean, are there things you're working on now, or ideas you're kicking around?
Well, I'm just a writer that keeps on going. Fortunately, unlike a lot of other professions, I can sort of keep on working, and I still see a couple patients a day, and I'm still writing. And after the last book, the Spinoza problem, it's a long, hard work. That was a major novel to write. It's kind of too hard to do that at someone at my age. I don't think you're going to see many people writing novels at my age now. I'm over 80. And so I'm writing short stories, all teaching stories about therapy. I wrote a book many years ago called Love's Executioner. And these will be stories that are something like that. Each of these are meant to be teaching tales. Each of them begin with some small vignette about a patient that I think has power to teach us something about what we're doing with our work. So I've got a series of these written, and I'm working on those all the time. So that's basically what I'm doing, as well as speaking about always for writers, always speaking about your last book.
Yeah. I was actually required to buy Love's Executioner in grad school, and I was glad that I did. Say there aren't a lot of books. I mean, there's some books, of course, but many of the books I was required to buy in school, I wish I hadn't been required to buy them. But I was glad to have Love's Executioner. That was a good book.
Yeah, that was a real liberation for me. I had written a lot of stories before in my textbooks, like a textbook on group therapy, and I just sort of smuggled them into the book. Sometimes they're just a paragraph, sometimes a page or two. But to not use the story to illustrate the point that you're making in nonfiction, but to just do the opposite, to put the story first and let it talk for itself. And that's what I did with Love's Egg. I intended to have a 50 or 60 page discussion of the stories at the end and what I was really trying to say. But I had an editor at that point who was very good and said to me, no, that's not going to work. She was an editor from hell in many ways, in that she crossed off page after page after page. But she said, let the story stand for itself. Do the teaching within the confines of the story. So that's what I'm doing. And recently, the publisher put out a new edition of Love's Executioner. You've got the old one, but they put out a new one. And what they asked me to do was to write a long epilogue, looking back on these 10 stories and how I feel about writing them. And that was a very interesting exercise. I think I wrote a pretty good piece. And it was a very interesting exercise for me to go back after 25 years or so. You know, I felt proud of the stories, but I also felt that this guy who wrote those stories writes a lot better than I do now. And then I also had the interesting experience. One good thing coming of older age is that I realized that I started to read these stories. I hadn't read them for so very long. I had forgotten quite how they ended. So I was all excited to find out how each story ended. So I could write a little paean here about praise of old age and the forgetfulness that you have. So it was a good experience for me to write that.
Well, you know, I'm going back and rereading books from my childhood even now, just to have something apart from professional kinds of reading, and just because it's interesting, and I remember loving those books, and I have no idea how it's the same sort of thing. It's like many of them, there's so many parts that I don't remember. That, you know,
sure. Which ones have you gone back?
Like even
to?
like The Hobbit. And like
great book.
Yeah.
Yeah, I do that. I'm doing the same thing. I've been reading novels all my life, and somehow I'm not clicking with a lot of the contemporary novels. So I find myself rereading a lot of books I've read in the past, and it's, you know, I don't remember them. Just like I see movies I haven't seen in 30 years. Well, I don't. Yes, I've seen that movie. It sounds familiar, but I really don't remember too much about it. So I've got a whole world of new old things to see and review.
Sure. Well, I don't want to take up too much of your time, but if there's anything else we haven't really touched on, things that maybe you want to think people should know, or anything about anything. I mean, feel free to talk about it.
Well, let's see. I don't know what else to say. One of my major interests has been in group therapy. I'm a little puzzled at this point. I'm going to start to do a revision of that group therapy textbook, and I've been thinking a lot about groups. And it's very odd to me that in so many communities, my own, for example, group therapy is far less commonly used than it was in the past. I don't understand that. It may be kind of an economic thing. It may be there's so many new therapists now, counselors and marriage and family therapists that don't have free hours, so they don't want to send anyone to a group. They'd rather fill their hours with the patients. So it may be an economic function. But I don't know if you've encountered that, but I'm very puzzled that here's a very effective mode of therapy that's not being used to the same degree it was 20 years ago.
And I learned from your group therapy textbook, in fact, like the stages of group therapy, and my wife loves group therapy, and she got to do. She's a psychologist as well,
Yeah.
and she got to do some like in the VA. She doesn't do it as much, but they still do it to some extent. I mean, a lot of times when I encountered it, kind of, I'm more in a private setting. There's maybe like some very brief kind of psychoeducational sort of things.
Well,
where
yes,
it's
there's
not
a lot of
known.
groups,
Yeah.
but you're exactly right. There's psychoeducational, where you're almost lecturing to patients, or you have a certain schedule. You're going to cover a certain number of topics in 4 or 5 sessions, or panic reaction, or so. But by doing that, they're missing the absolute best feature of groups, because the real power of groups is that people can work on their interpersonal issues with other people by working on them and the members of the group. The group's a microcosm in a sense, and then all the problems you encounter with people will begin to manifest themselves if you're really honest and working with your feelings with 7 other people. So it's a powerful mode of therapy, and I am sorry it's not used as much as it was. And the same thing can be said, too, for conjoint family therapy. My own area, I'm in the Bay Area, I'm at Stanford, and this whole community around here, there are very few therapists who are really adept at conjoint family therapy, seeing everyone in the family, parents and children, and other people related to the family in the same room. And very few people have that skill anymore. And that's a loss for the field.
That's probably true. I'm sure it's true, and I'm not sure what all the causes of it, and whether it's because of reimbursement or because of how difficult it is to get patients in general versus getting enough to fill a group. Or, you know what I mean? For some people. But I mean, it's definitely, people listening should kind of think about that, and even like whether it's people who might be looking for treatment, they might consider whether group treatment might be something that they'd like to try. Yeah.
Yep, I hope so. I hope it has a revival. Okay, well, thanks very much, Todd.
I appreciate it.
Okay.
Hey, thanks a lot.
You're welcome. Bye-bye.
Remember to check out Dr. Yalom's website at www.yalom.com. That's how you spell Yalom, if you didn't know. And you can see that link and links to some of his books and find other podcasts at www.mentalhealthday.org, which is our site, in case you didn't know. Thanks again for listening, and why do we put the theme song at the end? Weird.